Hi, I'm Steven. Today is a practical exam for joint mobilizations. Um, so the case study today is a 60 years old complaint of neck pain and occasionally headache bilaterally. Both left and right rotation pavement are quite stiff in the entire cervical spine. Tenderness around the C2 and C3 spinous process, and restriction in the bilateral C0 to 4 PA UVM. So the joint mobilization I'm going to use is distractions, movement, rotations, PA CVP, PA UVP, TVP as well. The grade I'm going to use is grade 3, which is a large amplitude movement that reach the end range of the movement. If the patient feels uncomfortable, then we'll choose the grade 2 instead. So each set of the mobilization is 10 seconds for each side and each mobilization. So the cervical is actually resting or open pec position in the slightly extension, and closed pec position is full extensions. So right now I'm going to show you the distractions for mobilizations. So at first I'm going to hold the head with my left hand and then use my right hand to hold the chins. So gently pull both of the hands superiorly and slightly move the body backward to provide the distraction movement for 10 seconds. This is good for the right neck, cervical joint locking, and head deck. For the progressions, we gotta you can lift the neck for flexion 30 degree. The next one is rotations. For the rotations, it's the same thing. We gotta use the one hand on the head, another hand to hold the chin. So the head is gently turned to the side with both hands moved together. The finger of the left hand should produce as much movement of the occiput as the right hand produces with the chin, which is performed purely by the arm movement. I'm going to show you the another side. So my hand on the head, another hand on the chin, and move together. That's it. So this rotation is good for the unilateral pain cervical and rotation of the head away from the patient's painful side. And the progression is to lift the neck flexions for the progressions. So the next one I will show you is a PA CVP. So can you please facing down for me? So the PA CVP is to use is good for the cervical joint locking. Okay, I'm going to move a little bit. What is this? So I can see my hand. Yep. So the PA CVP is used to for the cervical joint locking, headache or migraines, degenerations, and muscle spasm. So at first, I got to find the C2 and C3 spinous process, palpate with the thumb, and push anteriorly using the force from my shoulders, transmit through the thumb with the whole hand. So got to find the C2 and then use the whole thumb and move with the elbow lock for 10 seconds. After 10 seconds, we gotta move to the C3 and move anteriorly, PA, CVP. So the progression of this PA, CVP is to in a supine position and perform in a slightly extension. The next one I want to show is the PA, UVP, which is use the thumb move laterally away from the tip of the spinous process and rest entire on the transverse process. So the first is like to see C2. We got to find the C2 first and then move on the side. Okay, and then apply the pressure anteriorly. So this is good for the unilateral cervical pain or head pain and the stiffness. So be careful to perform the technique with gently, and then I'm going to move down to C3 and mobilize for grade 3. This technique is usually more effective when performed gently. Okay, so we're at C4. And C5. The progression of this is to supine position with the neck in lateral flexions or rotations. And C6. And C7. After C7, we got to move to the left side of the unilateral transverse process. And then we got to find the C2 first, and then move to another side, and then lock my elbow and use my shoulders pressure and move down with the whole hand force. And then C3, C4, C5, C6, C7. Alright. The last one I'm going to show you is the TVP, which is put my thumb on the spinous process, on the side of the spinal process, and then push towards the left side. So the transverse pressure is applied to the spinous process, and the pressure will be cause the rotation of the vertebral body. So right now I'm pushing to the C2. After 10 seconds, we go to C3. C4. C5. C6. C7. Alright, so I'm going to move to the on the opposite side. Same thing. Maybe I'll move a little bit of the table. Okay, so start from C2 and move. C3, C4, C5, C6, and C7. Alright, so that's it. This is for the all the what? Sorry, all the joint mobilizations. So the mechanism effect, what we're going to advise to these patients is like come for once a week to treat the stiffness and hypomobility. So be careful, the mobilization should be below the pain threshold, avoid the muscle guarding, and do not cause pain. If the patient produces a pain, we got to stop immediately. Thank you for watching.